Dr. Jason Mazzarella. Thank you in advance for viewing this presentation. My hope is that by the end of this presentation, we can change your perspective on motor vehicle accidents and show you that an understanding of the crash forensics allows for an injury occupant to recover and return to their normal lives faster, allowing for faster claim resolution and lower claim costs. Our unique crash forensic service combines physics, accident reconstruction to determine an injury potential, and then combines an injury-specific physical examination in order to determine what, if any, injuries occurred due to the motor vehicle accident. This is the only assessment and examination service available today that uses occupant kinematic analysis, injury biomechanics analysis, evaluation of the vehicle based on NHTSA crash testing, consideration of over 40 unique risk factors, and all followed by an injury-specific physical examination in order to make an injury determination. This is the smart choice, the cost-effective choice, and the right choice for all motor vehicle accident occupants. The crash analysis determines how the occupant reacts in the car. The injury biomechanics analysis determines what soft tissue structures are most likely injured, and the physical examination evaluates these tissues to determine if the collision resulted in any injuries, if any. Qualifications matter. No two motor vehicle collisions are the same. No two occupants are the same. Every collision has unique vehicle variables, road variables, risk factors that are either present or absent, and different types of occupant related to physical stature, their differences in height and weight, their body type, and musculature. All of this plays into determining an injury potential. We can't assume that every person responds the same in an accident, as every person in every accident is different. When we do, occupants get misdiagnosed, pain can persist longer than usual, and claims stay open longer. Like any specialty, training, education, and experience matter. In every collision, we consider over 40 risk factors. This allows for a completely unbiased injury analysis and determination, which can help the occupant, if injured, recover in a more timely manner. This is how just one risk factor can help determine injury: a low speed, far side impact collision. As we can see, as the car is struck, the occupants move towards the principal direction of force, the force being initiated by the bullet vehicle, the car striking the stationary vehicle. Now, if we watch the driver, this is an unaware driver looking straight ahead. And as we have impact, you can see his body moves from a relative left to right direction. So if we inspect this area of his neck, the seatbelt is acting as a fulcrum, compressing the anterior portion of his neck. Collision we just saw, there is a significant right lateral flexion force occurring to the occupant in the driver's seat. If this occupant reported numbness and tingling into the arm, how would you handle this from a plaintiff or defense perspective, a treating doctor or insurance perspective? Would you consider ordering an MRI or CT or maybe an X-ray or referral to a neurologist or orthopedic surgeon? By understanding crash forensics, the injury analysis is simple and the treatment is specific. As we can see from the example above, a common cause of this type of pain in this type of collision is a myotogenous referral resulting from an injury to the anterior or middle scalene muscle, and that's right here. And based on this collision vector, the seatbelt acts as a fulcrum, causing compression of this muscle, which then can refer pain into the arm and into the hand. Once this crash forensics analysis and examination is completed, a full physical examination is performed. What we do differently is that we first evaluate the areas of chief complaint of the occupant. Then we evaluate areas of injury potential determined through crash forensics, like we just showed. Unlike many other providers, we don't chase the pain, we chase the cause of the pain. Imagine how an occupant's recovery would proceed if a doctor only chased the pain. What if a person was having a heart attack and felt pain into the left arm? If a doctor chased the person's pain and only evaluated the arm, the patient would be in a lot of trouble. This is the same with car accidents. When an occupant is evaluated only by where they point, this increases the chance of treatment duration, claim duration, and costs, while ultimately prohibiting full and functional recovery and allowing the occupant to return to their normal life in a timely and reasonable manner. We strive to do better, and we believe crash forensics assessments and examinations is the way to do better. This is truly an all-in-one examination. Please feel free to contact us with any questions. Thank you.